Hello, I'm Lauren Vorderkins, and the hospital has asked me to host this nurses training session over attachment theory and postpartum depression. I know that the majority of you work in our maternity ward and may have already heard about our new policy in free services. However, it came to our attention that not everybody knew about them, so we decided to host this nurses training session so everyone would have the information needed in order to talk about these topics with our patients. We're going to discuss the new policy, the free services, what postpartum depression is, its prevalence and causes, what attachment theory is, how it correlates with postpartum depression, and the reason of importance for this training. So what is this new policy we keep hearing about? Well, the policy states this: all postpartum mothers will be screened for postpartum depression. They will have access to free attachment education, and they will have access to free counseling that is on site in the East Wing at the hospital during their hospital stay. So what are these free services then? We're going to offer free attachment education, which will be videos, pamphlets. If somebody feels uncomfortable, we can have a nurse come to their room and do a private one-on-one session. Or we also have group sessions for discussion. We will also have free counseling during the patient's hospital stay. The patient can either go to the counseling center at the East Wing, or if they like a private session in their room, which would maybe make them feel more comfortable, the professional counselor will visit them at their room. We'll also have group counseling available twice a day. It'll be once in the morning and once in the afternoon. So what is postpartum depression? The staff at the Mayo Clinic describe postpartum depression as something that follows childbirth and is a complication of giving childbirth. It is a severe form and long-lasting form of depression. But is postpartum depression common? Yes. Actually, we see that noted psychologists Whiffen and Johnson, along with the researchers from the National Institute of Psychobiology from Israel, state that between 10% and 15% of women are diagnosed with postpartum depression, the average being 13%. And almost half of postpartum women get the blues, which you may have already seen in your nursing practice here in our maternity ward about patients describing feelings of tiredness or sadness, but they say they're not depressed, but they are experiencing those symptoms. But what causes postpartum depression? Nagoya University researchers found that half of the women diagnosed with postpartum depression had personal and family history of mental illness. There are also hormonal factors that these women have experienced during their third trimester. And they also perceive a lack of support, whether it's from their partner or just social support. Now let's discuss attachment theory. What is attachment theory? Well, it was developed by British psychologist John Bowlby and American-Canadian psychologist Mary Ainsworth in the late 1980s, early 1990s. It focuses on attachment between child and caregiver. It studies separation, deprivation, and bereavement. Attachment affects an individual's behaviors and future relationships, which is why the hospital found it important to create the new policy and offer these free services. John Bowlby stated that the goal is to obtain a secure attachment, which is warm, intimate, and continuous. Let's remember that. Warm, intimate, and continuous. So how are attachment theory and postpartum depression related? The mother-child attachment is affected by the mother's disposition. University of New York psychologist researchers found that dismissive mothers were more likely to be angry at their babies. And It's also related because attachment with one's partner can influence the mother-child bond. But why are we learning all of this? Well, we need to be educated so we can explain all of this information to our patients. And attachment education is important. It makes sense. Australian sociology professor Mira Crouch found that increased mother-child contact decreases stressful and depressive symptoms. So if we can educate our patients about attachment theory, it might make sense to them and help them decrease their own depressive symptoms. Plus, Doctors Whiffen and Johnson, who are noted psychologists, explain that individual and couple therapy really help women who are experiencing postpartum depression. They focus on an emotionally focused therapy, or EFT, which promotes secure attachment. So let's conclude this presentation. What we want to take away from this is spread the word. Everybody in the maternity ward, all the nurses, need to know about this new policy and the free services. So we need to create policy reminders. They should probably be in every room so that way the nurses and the patients can see them, and they should probably be at the front desk as well. And just remind your nurses to talk about it with the patients. Just help each other out there. Tell patients about these free services. We spent a lot of money creating the East Wing Counseling Center, and we want these mothers to get the help that they need. We want them to have the counseling and the education. Don't forget to explain what postpartum depression is to patients and what attachment theory is so they have a better grasp of how they can help themselves. And don't forget to explain the importance of attachment theory in relation to postpartum depression. And the very last thing we need to remember is to be supportive. All the time, just remember it, be supportive. Be supportive with the nurses in the maternity ward about the new policies and free services, and be supportive to the mothers who may be going through a rough time right now. And also see if you can be supportive with their partners as well. Provide information to them and let them know about the counseling center. If you have any questions about attachment theory and postpartum depression, please contact me. My office is in B111 in the east wing of the hospital next to the counseling center, and we can discuss any questions that you may have. I also want to remind everybody that we are a private hospital. We are a Christian institution, and we need to convey that to our patients. We can use a verse, Isaiah 66:13, that says, "As a mother comforts her child, I will comfort you." And we need to take this as an example to comfort the mothers that come to our maternity ward and to support them, especially if they are experiencing postpartum depression. Thank you so much, and I hope that you can get out there and share the new policy and services with everyone that you meet. Thank you, and have a great day.